You will be limited to one question. Please also unmute your phones. You will not be audible until I call your name. First question is from Vaughn Palmer, Vancouver Sun.
Good day. The recent outbreak at the ICU in Abbotsford and the renewed outbreak or second outbreak at the Langley Lodge, I wonder if you've been able to determine the origin of these two and whether or not it was related to healthcare workers moving between multiple facilities, please.
Yeah, as far as I'm aware, it's not due to people moving between facilities. The investigation, of course, is ongoing, but it is related to unrecognized illness in healthcare workers and also in patients in the ICU case. So, it's the challenging thing that we have. And I mentioned this before, this virus can be very subtle in some people, particularly if people are in hospital with illness for other reasons, and it may go unrecognized. So that is a challenge we face. And why it is so important for us to have done what we did to reduce the burden of the pressure of illness in our healthcare system, because it allowed us to, for the most part, recognize cases early, make sure that healthcare workers had the time they needed to make sure they could respond and use the appropriate PPE. But unfortunately, in this case, an unrecognized case and then transmission between some staff members.
Next question is from Cindy Harnett, Times Colonist.
For taking my call. Dr. Henry, you broached how difficult it's been for people and families related to long-term care. What needs to happen before seniors in care homes and patients in hospitals can have perhaps at least one visitor? And when do you see that happening, if at all, this summer?
Yeah, I do see that happening, and it will take us continuing to control the virus both in the community and in our long-term care homes and in our hospital settings, and we have seen a decrease. What the challenge, of course, becomes everybody wants to have their one, and so we need to make it in a way that is safe for the rest of the community, and that really what each of these, particularly in our long-term care homes, they're a community as well. So it has to be a way that allows that staff feel safe, that they can manage to support people to come in with their loved one and to provide that support to their loved one. So I know they are working on it, and it may look slightly differently in different facilities depending on how many people there are per room, what type, how large the facility is, and that sort of thing. But I do expect that I'm hopeful that it will be sometime maybe in June as we see our numbers decrease, and a lot of it will, of course, depend on our ability to keep control of this virus in our community and our long-term care homes. So that's the paramount thing right now. If all of us do what we have been doing and we continue to be thoughtful and careful as we move through the next few weeks, I'm very hopeful that starting later on in the summer, we should be able to make those incredibly important essential visits more available for family members and for our seniors and elders who really do so need them.
Megan Batchelor, CBC.
Hi there. Thanks for taking my question. As we go into phase 2 tomorrow, how concerned are you about more cases popping up? How will we know when it's working? What will that look like?
Yeah, so we know the incubation period for this virus is 2 weeks, so we will be watching very carefully, as we have been doing. So as you know, we've expanded testing so that it's available to anybody with symptoms. We are finding cases in the community, and we are linking them. So that is the thing that we will continue to do in public health. Our contact tracing resources are ready to go and are working full time. And so, yes, we will, part of it will be ensuring that we are able to test wherever it's needed. And I think we have that capacity now around the province. We'll be watching very carefully for new cases as they come up. As businesses and retail stores and salons start to reopen, there's an onus as well on you, on all of us, to ensure that we're monitoring very carefully for symptoms, and we do not go into work, we do not go visit our hair salon if we are feeling the least bit unwell, and that we are able to be tested. So those are the things we'll be watching. And of course, when school starts again in classroom schooling in a limited way, albeit in June, we'll be watching very carefully there as well.
Laura Brom, CFAX.
Hi. So on Friday, the education restart plan was announced, and it said people who are sick will not be allowed in school. And so in phase 3, busing is planned to be reintroduced. So I was wondering, for students who are taking the bus to school, will bus drivers have the authority to say, sorry, you're presenting with illness, like you're sneezing and coughing, so you're not allowed on the bus? Or is it only once the student gets to school that school administrators have the authority to say, sorry, you're not allowed in school today?
Well, I think it would be a conversation with the parent and the child if the bus driver noticed something. Absolutely, there's no authorities that I'm aware of in that sense. But yes, we would expect that parents will have that conversation with their child and make that determination before they send their child to meet the school bus. And also, that's a place where bus drivers may have the ability to test, but to tell, but may not. And so it will be, people will be asked again about health as they come into the school. So there's different places, but it really is about having that low sensitivity, and if you're not feeling up to it and you're not feeling well, to stay away and stay home.
Next question is from Shirshti Basu, Victoria Buzz.
Hi, everyone. Thanks for taking my question. Dr. Henry, you talked last week about how outdoors is better than indoors and provided some examples of social interactions. I was just wondering, what is your direction on casual outdoor sports that involve contact, like soccer and basketball? Like, can a group of kids go to the park and enjoy a casual game?
Yeah, so there's some of the more formal things. We're still working through the details of how to make them work come the period where we start to see more organized sports, but we are seeing some of that right now. What we want to say is small groups, right? So if you're going to have a casual game with some friends, fine, but avoid the close contact with a lot of people. So small numbers, we're saying, keep it to 2 to 6. Outdoors is good. Maintain your distance. The other things that we have to factor in is time. So if you're coming close with somebody for a brief fleeting second, that's not as risky as spending a lot of time in close contact with them, even outdoors. So those are the things that we need to pay attention to right now. And the bottom line is we don't want congregating of large groups, because that's where we know this virus can be spread, and we've seen examples of that, mostly in indoor settings, but some outdoor settings.
Next question is from Lisa Cordasco, CHLY.
Thank you. Minister, you mentioned earlier about the BC Ferries numbers. What about the sort of checks that went on, at least some on Vancouver Island, by the BC Conservation Service and the RCMP, talking to people about things ranging from fishing licenses to whether they were planning on camping overnight. Do you have any numbers on how many people were advised, not to do that, or were any fines of any type handed out? And also, can people camp right now on Crown land? And if so, are you considering having a ban on that until overnight camping opens in provincial parks?
I think rather than trying to answer, Lisa, I'll get that information for you, and perhaps we can either report on that tomorrow, or more likely I'll ask Minister Heyman to report on that, and we'll get you some of the information about what's been going on in this first period since the reopening for day use of BC parks.
Next is Keith Baldry, Global News.
Hi, Dr. Henry. Just a question of clarification about your public health order on restaurants and pubs and such. The 50% capacity, maximum capacity rule, obviously a number of restaurants aren't going to be able to meet that in terms of being able to survive. So what's the 50% based on? And a clarification, the tables have to be 2 meters apart, but from what I read, the maximum 6 people around a table aren't necessarily 2 meters apart. Is that correct?
That's correct. Yeah, so, this is based on, there's not a lot of science. It's based on trying to put together a rational approach to how many people would create enough of a crowd that we would put others at risk. And part of it is, being able to find that physical space. So for many people, depending on how your restaurant is configured, to be able to have the space between tables that allows for that, you won't be able to make 50% of capacity. But we needed some limits, and it was around congruency with other gatherings, for example, events where 50 seems to be a reasonable number. As I've said from the very beginning, there is not a lot of science. We're sort of trying to figure it out with things that we know could make a difference in prevention of transmission of this virus. So I've talked to my colleagues across the country. Many of them have gone to smaller numbers and are continuing with smaller numbers. We've stuck with our mass gathering at 50. This is a slightly different situation, but it just, it seemed like a reasonable approach in conversations with industry. It was something that gave a little bit of a limit around the number of people that could be in a place at a time. And we will be, this is for this phase. So this is to encourage people to take it slowly and to look at how we can do this and monitor carefully to make sure that we're not creating situations that allow this virus to be transmitted rapidly in our communities again. So we will be looking at it again as we move through this phase and find out if, we'll be willing to take direction from industry as well about how it's working and what we can do to tweak and to manage things as we go forward.
Nick Wells, Canadian Press.
Hi, thanks for taking my question. I'm just curious what you would say to businesses who are opening again tomorrow but are kind of concerned about how they'll handle all these new health precautions.
Yeah, I would just say take it slow. They're here, we're here, WorkSafe BC, the environmental health officers in your local public health unit are here to help guide you in this. But we know, and I know absolutely there's anxiety on both sides, and there's anticipation on both sides. So people are looking forward to getting back into the environment, but many people are a little bit afraid. So this is our way to say, here's what we're doing. We're going to err on the side of being as careful as we can. We know the things that work are keeping the safe physical distance as much as possible, making sure that we have hand hygiene, reducing the number of people in there, and having multiple occasions to be able to ensure that anybody who comes into our space is not ill themselves. And that's a really, really important thing for all of us to consider. So it is going to be a bit of a anxiety-provoking week for many, many people. And then we'll get used to it. We've gotten used to some of these social interaction restrictions that we've had. We've gotten used to how to get through a grocery store in a way that doesn't put others at risk. We will get through this as well. But for this week, take it slow.
Next question is from Frushi Gangdev, CKNW.
Hi, Dr. Henry. I'm just wondering, you mentioned you're asking people of a variety of cultural backgrounds and ethnicities to respond to the survey. When that information is received and analyzed, will you be releasing that and using it to inform the province's response?
Yeah, so there are questions, and some people ask me questions about why we've included those types of questions in the survey. And it really is because unless you look at it from that perspective, you don't know if there is something that we're missing about who is being affected, either in a positive way or a negative way, both by the virus and by the effects of the restrictions that have been put in place. So it is really important. We know that that there is associations between poverty and health. There is associations between certain ethnicity and racial groups that have had impacts on people's health. So that's why it is important for us to use that information. We obviously will not be releasing it in any way that would identify any individual, but it is a way of helping us understand the differential impact in different communities and different populations across the province. And that's why it's so important. In the same way that we need to understand how it affects people at different age, these are also important things that help support health. And we talk about the social determinants of health, and those are the ways that we measure those social determinants so we can understand where we need to put the resources to support people.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later today with all the information covered off. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Nick Sweetman, CHLY.
In March, fatal overdoses in BC increased by 61% compared to February. March also saw 7,000 fewer visits to overdose prevention sites and safe consumption sites. Could you tell me what's being done to increase access to OPS and SCS sites and encourage people who use drugs to visit them? And also, if you know anything about the fatal overdoses or SCS use for April and May.
Yeah, we don't have the final numbers for April and May, but this is something, of course, that I watch, and we have a weekly report that we've been looking at. There's been a whole number of factors that have led to the numbers that we saw in March, and believe me, these are important things that we have been following, and there is a plan. Some of the OPS did shut down their services, reduce their services quite a bit, particularly early on in this when we were trying to figure out how to best protect people, both the people who worked in the OPS and our peer support groups in the OPS, as well as people who use drugs in those settings, safe settings. I will also note that we still have not had any deaths at the overdose prevention site or supervised consumption sites around the province. There has been modifications that have been made that have allowed them to expand their services again. And we know that in several communities, like here in Victoria, other types of provision of overdose prevention services have been made. So they went from their one standalone place to having mobile overdose prevention services because of the way that the challenges we were having with the shelters, for example, and people being more dispersed around the province. So we've seen a number of different things. The other thing that I am very concerned about is, of course, the increased toxicity of the drugs on the street right now, and a lot of that has to do with the difficulty in getting that it's been more challenging to get some of the drugs into the province, which means that they're being cut with different things or being attempted to be manufactured within the province. And that has led to an increased toxicity, which of course is part of the tragedy that we're seeing in the last little while. So we have seen both an increase in severity and we've seen clusters of overdoses, even when overdose prevention services were available in those areas. So it has been a work in progress. I think one of the key important things that we have been doing around, particularly around Topaz Park here and Pandora and Oppenheimer Park, is moving people into more safe shelters in where they have their own room and their own bathroom. That makes it safer for them, but then making sure that we have those overdose prevention services so people are not using alone in those settings, and that's a big challenge, as we all know. We also know that that over half of the overdoses happen in young men who are using alone at home, and this is still another very challenging thing to get people to, when we're all isolating, to have somebody that they can reach out to. And I know there's been a couple of initiatives like using apps to support people who are using alone. The other thing that is incredibly important, we came out with safer supply guidance, and that has been moved out around the province to various different degrees. It's been a challenge, and that is something that we are continuing to focus on, making sure that people who use drugs are able to access safe, regulated or safe pharmaceutical alternatives to what we know is an incredibly toxic street supply. So that initiative also continues.
That's all the time we have for today. Thank you.
Thank you very much.